President Trump is now arriving in Norfolk, Virginia. We don't have those live pictures to bring to you just yet, but we will momentarily as soon as we do. In the meantime, let's bring back our medical panel of experts. They are going to answer some more of your questions that you have been submitting to us all morning long. Again, let's welcome Fox News medical contributor and family emergency medicine practitioner Dr. Jeanette Neshawat and medical director of infectious disease prevention at Ascension Via Christi, Dr. Maggie Hagan. Thanks to you both for being with us. Dr. Hagan, the first question we'll throw over to you. It comes from viewer Christopher Diaz, who says, with testing, I know we can't test everyone with no symptoms for the virus, but will it be possible to test everyone for the antibodies so that those people can go back to work?
That's a good question. Yeah. We believe that people who are infected with COVID-19 will develop an antibody to the virus that will be protective. How long that protection will last, whether it will be a few months or a few years, we don't know. But the ability to measure that antibody would certainly be helpful to know who has been infected, because as you know, many of the people that are infected don't have symptoms that bring them to medical attention. So if we had that antibody test, that would be helpful. There are some very preliminary data looking at antibodies, and as you may be aware, even studies looking at using antibodies from people who have been infected as treatment for those who are currently battling the disease. So a lot of work is being done regarding antibodies, and we would be hopeful in the future that that testing would be made available.
Dr. Neshawat, we have a question from viewer Ray Sanders, who says, if you happen to get COVID-19, would using a nebulizer help your issue with your lungs, or will it make the situation worse?
So my patients, for example, who have asthma, who tested positive for COVID, they have expressed to me, and I have seen improvement in their oxygen level and their O2 sat with albuterol inhalers and nebulizer treatments. But the problem is when you use a nebulizer machine, you could be aerosolizing the virus and it could spread in the room and you could potentially make other people ill. So you have to be very careful and keep that in mind. If you're going to use a nebulizer machine to help with your breathing, to help with your asthma, to treat the shortness of breath that we commonly see, then you want to use it in one room of the house of where you are so we don't spread viral particles to other people, because that is a concern.
We are taking a live look there for our viewers at home at Air Force One. President Trump has just landed in Norfolk, Virginia. He's about to deplane. We'll keep an eye on that for you. In the meantime, Dr. Hagan, I'm going to come back to you. We've got a question from Dana Gilbert, who says, is it true that you should avoid ibuprofen, Aleve, and aspirin if you get COVID-19? That's a good question. I keep hearing about this.
Yeah, there have been a lot of discussions about ibuprofen over the past couple of weeks and some mixed messages regarding that. There were concerns that it perhaps could make the viral infection worse. And in fact, some countries even came out with a warning against using that. The World Health Organization came out with a statement on the 17th of this month saying they were looking into the issues regarding ibuprofen. But the very next day, they came out with a statement saying that they didn't have any data that suggested you should not use ibuprofen. That being said, to treat the symptoms of fever and body aches, you might consider using acetaminophen, because we believe that that is safe for treating the symptoms of COVID.
Oh, okay, so maybe acetaminophen. Dr. Neshawat, want to throw the next question to you. This comes from viewer named Nadine Escalonia. She says, I am having a baby in July and I'm getting really nervous. I'm worried about bringing a baby into all of this. Quick note on that, it sounds like World Health Organization has also said they don't know a whole lot about in utero transmission. They suspect it's not happening. What do you know about it?
Sure. So we saw 9 cases. I read about 9 cases in China with 9 moms who gave birth, and there was no fetal maternal transmission of the virus to the newborn baby. There was one case where a 30-hour-old baby tested positive for coronavirus, but did very well and recovered very quickly and had no complications. But first of all, congratulations on having a baby. The best way to protect yourself and to protect your baby is to protect yourself. Follow the CDC guidelines of hand washing, social distancing, staying hydrated, taking your prenatal vitamins, those sorts of things. And the good news is you're going to be giving birth in July, in the summer. So hopefully the heat will diminish the amount of cases and you won't have to worry as much.
Yeah, definitely a question, at least in my friend group, with so many people expecting and new moms. A lot of women are asking, what does all of this mean for us? Not a lot of information out there, sadly, but thanks for bringing us, what we do know at this moment. Dr. Hagan and Dr. Neshawat, thanks so much for your time. We appreciate it.